When I was growing up in the 80s, just down the river, a few miles in East London, the prevailing political philosophy of the time was that government was the problem, not the solution. And that didn't really reflect my own experience. The state helped my mum to feed me, clothe me, house me, to keep me healthy and to educate me. And I would say that standing here today as a cabinet minister in a Labour government, that I am here in no small part thanks to the wise investment of the British taxpayer. But nonetheless, there was a bigger idea in the 80s that held sway, that government needed to get out of the way, that lower taxes and lower spending was the route to economic prosperity and therefore to liberate people to look after themselves. This Thatcherite, Reaganite approach was a response to the post-war years where successive governments rebuilt and ran Britain through an ever-increasing entourage of nationalised institutions.
Yeah, again, another round of great questions. On that latter point, I think you're absolutely right about the role of the public sector in procurement and thinking about the nutritional value of food that we provide, whether to pupils or to patients. I'm working with Bridget Phillipson, our Education Secretary. I may have heard of her in recent days, and we're working together on improving the nutritional value of school food. I will be looking at what's going on in terms of NHS food as well, trying to resist the temptation of being yet another health secretary to appoint my favourite celebrity chef to come along and tell me that it's not good enough and needs to improve. But I don't think we've seen, and I've certainly not experienced, the improvements to sort of healthy nutritional food in the NHS. And it's something we need to take seriously. To the second question, budgets aren't in decline in my department, but it doesn't feel like that necessarily in every part of the NHS because I'm doing two things simultaneously that are entirely necessary. One is delivering increased investment into the NHS, which will be sustained over the course of the spending review period, and also reining in where I think money is not being put to best effect and making sure we're diverting money to areas where it will be higher impact and better outcomes. So for parts of the NHS, it might feel like they're constrained, that funding's going down, but in fact, it's going up, and we are rediverting to important priorities. We've got to do better on life sciences, on technology and innovation. Too often medicines have been seen as almost like a kind of dead weight cost. I'm very proud of NICE and the way that we've driven value for money as great new Labour success story, but we shouldn't just consider medicines to be a cost. We should consider medicines to be an investment in people's health, people's well-being, and a better way for people to live healthier lives for longer and have a better quality of life. I think the challenge is, when you think about, take obesity as a really good example, this isn't just a case of people not being responsible. It is because people do not exist in a vacuum. They exist in an environment where the unhealthy choice is too often the cheapest choice. So you don't want to penalise people for being poor and turning to the solution that's affordable to them, not the one that's necessarily best for them. We are constantly being bombarded with marketing, and we often make the unhealthy choice the harder choice. So I think there's lots on us to change and shape, but I think it's a good broader question for our society and public policy. I've forgotten your first question. It's essential if we're to rescue the NHS from the biggest crisis in its history and make it fit for the future. But simply reforming the NHS is not sufficient. Lord Darcy's diagnosis was clear, that just as the National Health Service has deteriorated, so with it has the nation's health. Britain and British people are getting sicker and falling into ill health earlier in life, creating a rising tide of cost and demand that threatens to overwhelm our health service and hold back our economy as well as people's lives. That's why our 10-year plan is a 10-year plan for health, not just the NHS. And it's why Labour's health mission didn't just promise to cut waiting times, it promised to close the gap between the richest and poorest regions and help everyone live well for longer.